So now I will discuss about the injuries recognized at operation. So there are certain type of injuries that could be recognized at the operation. uh, Number one, there may be injuries. Okay, so I keep the point at 2. 2 is standard. Okay. For high complete transaction, if I observe that there is high complete transaction, then my choice of treatment would be Rho and Y hepaticojejunostomy. Okay. So it is considered preferable to a different direct suture repair, as disease become the stricture in time. For lower complete injury, with a serviceable proximal duct stump, the primary suture repair with fine interrupted absorbable suture over T tube is the treatment of choice. So, if there is complete injuries with a serviceable proximal duct stump, if there is a proximal duct stump, then we should go for primary suture repair. We have to repair primarily, and then fine interrupted with what? Fine interrupted absorbable suture over T tube, and it is the treatment of choice. The long limb of the T tube must not be exteriorized. The long T tube limb must not be exteriorized through repair site. This chance risk of stricture formation. So when there is a repair site, we must keep in mind that if this is my T tube, this is my repair site. Okay, this is my repair. If we observe that there is injury, and so we must keep my T tube under the injury. Okay, I think that this is T tube. T tube should be here under the injury, not through the injury. If the injury is here, it should not be through the injury. It should be under the injury. Okay, partial lateral injuries treated by insertion of T tube. If there is partial lateral injury, it should be treated by insertion of T tube and Rho 1 Y serosal patch. Do you understand what I mean? That there should be a Rho and Y patch and T tube insertion. And partial lateral injury, the long limb of the T tube is exteriorized through the mobilized jejunum. If there is partial or lateral injuries, okay, partial or lateral injuries, then what we should do, we should insert a T tube and Rho and Y serosal patch. And the long limb of the T tube is exteriorized through the mobilized jejunum. So we should keep one way where there should be one mobilized jejunum. Here is that. Here we can see that there is a T tube here. There is a T tube, and there which is exteriorized through a mobilized jejunum. Here in the blue we can see this is jejunum, and through the mobilized jejunum we can exteriorize the T tube. So when there is partial or lateral injuries, okay, we can perform this.